Okay, good morning all.
Good morning, all.
Okay, today we are again here with another live session, is it?
Yes.
Yes, today we are dealing with.
Clear your doubts with us in no time, and you can ask your doubts with us, and we will clear it out.
Okay, before that, let me check who all are there in our YouTube and FB, is it? Ma'am?
Okay. Yes,
Okay.
ma'am.
Good morning, Fesi ma'am. Good morning, Sheena. Hi, Anusha.
Hi, Anishwara Murali.
Good morning, Alvin sir. Hello, Adil.
Hi, Vivin sir.
Okay, let's start.
Yes, ma'am.
Okay, before starting our session, we will share some information regarding our OET, is it?
Yes, we are having great information.
Yes.
So first of all, I would like to tell about the we are having centers in Bangalore and Mangalore. So for the first 50 applicants, you can study OET or IELTS until you pass, especially in Bangalore and Mangalore.
Yes, that's a great news from our side. Okay, and then our OET crash courses. Okay, July 22 date. July 22 exam batch crash course will start on Monday. And another news is book your OET exam with in 33,300. Only it's reduced is amount, is it?
Yes, it's a great news for everyone.
For everyone, okay, who are looking forward to
OET exams.
take OET exams. Okay, and then next one.
Next one, okay, our new batch will start every Monday.
Yes, for our OET and IELTS, as you know, as every new batch start on Mondays. Okay, and one more thing is that that's a very good news. Our June 10th results are published on last week, is it?
Okay, we are having an amazing results.
Yes, as usual, we have an very good results. 100+ results are there, is it? Okay, and these all are our news, is it, ma'am?
Yes.
Okay, then shall we start?
Yes.
Yes, okay. As I told you before that we are dealing with the writing sections, and we can just discuss. This is an just interaction section with you, and we are dealing with the mistakes of our students, and especially your doubts are we are dealing, especially, is it, ma'am?
Yeah. Already we have collected many doubts and concerns from our students. So we will discuss in this section.
I think it's a little bit better for this live section because we are collecting a lot of informations and doubts regarding our students. Okay, so we can discuss it with that. Okay.
Okay. So could you please tell some basic information for the beginners?
Yes, for the beginners, we can start with the OET essential parts. That means basic sections. That is our OET is, of course, you know that the OET section 5 minutes preparation time. Need to organize all the letter or writing task, and then the balance 40 minutes you can write the letter. Okay, but for our practice section, we only make a 35-minute section, is it?
Okay.
Okay. So then, before going further, we need to say something regarding our criteria also.
Okay. So before that, could you please tell me about the word count?
Yes, of course. I forgot that it's 180 to 200 words. Okay, hope you all know that.
Okay. So what will happen if they are writing above 200?
It's chance to reduce our scores.
Okay.
Okay.
So it will consider some irrelevant informations are added. Right?
Yes, added. Okay, so of course they make a letter according to our word count 180 to 200.
Okay.
Okay, so let's we check regarding. Okay, some of the members are coming with us, is it, ma'am?
Yes.
Okay, so then what about the criteria?
Okay, there are 5 criteria which we should remember while writing a OET letter. So first one is purpose.
Yes, purpose and content. That's the main thing in our writing criteria.
Okay, so as ma'am told, second one is the content.
Yes.
And third one is the
Conciseness and clarity.
Okay.
Then add the fourth one.
Fourth one is the genre and style.
Yes, and the organization and
The layout of the last one.
This is the 5 criteria among in our OET writing.
Okay.
Okay, so and general thing. There will be an address or date or address is there, then there will be designations, and then coming to that after there will be a reference, and we are preferring age rather than age. We are preferring for the date of birth. Yes. And there will be a introduction and a past or present, and either we can write the social history according to the letter.
And last we can go for the recommendation.
Yes, there will be a recommendation, then conclusion, and we can wind up that.
Okay.
Right. Okay. So from our students, we will collect a lot of consents, and shall we start with that consent?
Oh yes, ma'am. We can.
Okay. And most of the students are dealing they says that how we can write a different introduction. Okay, already we are dealing on a live section regarding our different types of introduction. Okay, like that we once again says the introduction. Okay, regarding our introduction, depends upon different writing criteria or a writing task, we can make the different introduction, and there will be we need to know that there will be an introduction like a full name of the patient and a purpose and the current health status of the patient, and then the content, the type of the letter. Okay. That's the 4th thing we need to include in our writing.
Okay, so ma'am, before this introduction, I would like to tell about how to identify the relevant and irrelevant points. So how we can find out from the case note?
Yes, it's not a simple thing, but most of the students are doubtful regarding the irrelevant and relevant details. Okay, it's just because it's dealing with the current health status of the patient, and moreover that the reader. It depends upon the current health status, the reader, and the recommendation paragraph. Okay. So these 3 things you need to remember while you are writing a letter.
Okay. So
I think this is the three things is the key point for all the students who are looking for the writing. Easy.
Okay.
Okay.
So before writing the introduction, I think they have to identify whether it is a non-case or a unknown
Yes,
case.
yes, that's another
That is
thing.
also very important.
Yes, okay.
Okay.
So we need to identify from our letter is it a known case or an unknown case. Okay, that's the best thing. But it's not a difficult part, I think, because they will provide like patient's GP or maybe they will provide a same address. Okay, from that we can identify that the letter is a known case or unknown. Is it?
Okay.
Okay. Other than that, anything I need to remember for our students?
One more doubt I have to clarify from our viewers. One Miss Baby Varghese. So they have she had sent that, hi ma'am, in case they gave the hospital name, do we need to mention the letter?
Yes. If they will provide a hospital name in our writing, no need. It's not mandatory to write in our letter. If you write it, that's okay. But no need to mandate. They will not reduce your score. Okay, you can write that, but they will. If not, they will not reduce your marks. Okay. So if you have time, you can write. That's enough. Okay, it's not
Or
mandatory.
they can just mention that Mr. So and so admitted to hospital.
Yes,
okay,
just we
that's
can write
enough,
as
I think.
hospital.
Okay.
Okay, then to the it's not to the hospital, to hospital.
To hospital,
Yes.
okay.
Okay, that's the main thing.
Okay.
And then anything else, ma'am?
Okay, first we dealt with the introduction,
Yes.
then we can go for the body
Paragraphs. Okay, and I already explained that it depends upon the reader and the current health status of the patient. We can write or separate or select which history is need to be present at first. Okay. If the current condition of the patient and the reader, it's only depends. Okay, you can write to the present and the social, and also you can write the past in between.
Okay.
Okay.
So,
And moreover, that the first thing is our current health status of the patient.
yeah, which is more relevant with the patient
Okay, yes.
and the situation.
Yes, okay, ma'am. And then our recommendation paragraph, which condition need the future care of for a patient. Okay, it depends upon that also.
Okay.
Okay. Then our another question is that how I use capital letters. Okay, it depends upon we already provide OET officials have provided some letters we need to mention as in a capital letter. Okay, in between the brand name and trade name of the medicines and emergency department. Okay, that all are the things that we need to mention
Which
in
is
our
accepted in our OET.
OET.
letter.
They will already provide in our OET official websites. Okay. So there are a lot of things we need to write in an capital letters.
Okay.
Okay. Then our another Janet Abraham. Can a letter to personal GP be non-case? Okay, personal GP will be a non-case, but if they are providing like it's patient's GP or maybe it's a known or unknown. Okay, maybe the GP is not known for the patient or maybe it's known for, it's an unknown or known. Okay, they will provide in your written task like patient's GP, then that means it's a non-case. But if they are providing like general practitioner or a local general practitioner is, it's not depends like it's a non-case, maybe it's an unknown case. Local GP means it's not the patient's GP.
But I think in letter they will specify and give
Yes,
whether
they will
patient GP or not.
Definitely they will specify its patient's GP or they will provide a same address in non-cases.
Okay.
Okay, and go for the next.
Yeah, one more student had there is a comment. We have to differentiate the use of sincerely and faithfully.
Yes, of course. And
It's the interesting part because everyone are having the confusion where we have to use sincerely and faithfully. So I think if reader's name is not given, we can use yours faithfully. Am I
yes, if the reader name or the address part, the reader name is not given, we can write it as faithfully, and if a reader name is given, then we can write as sincerely, especially Mr. John Richard. Then if they will provide a name in the address section or reader's name, then we can write yours sincerely. Then it's not mandatory to putting comma yours sincerely, but if you are mentioning in dear sir or madam, if you are putting comma there, then we can put comma here in the yours sincerely or faithfully.
Yeah.
Okay, that's a different. Okay.
Okay.
And the next section is, could you please discuss about difference between regarding letter and update letter? Yes, of course. Okay, we can, it depends upon the letter. Maybe GP is known for, GP knows the patient, but GP didn't knows the patient's current health status of the patient. Okay, if the GP knows the current health status of the patient or the current situation of the patient, then we can write, I'm writing to update the current health status of the patient. Okay.
So if students are writing, I'm writing to update without the current status of Mrs. So and so. If they are using only the update, whether it is correct or not?
Yes, it's sometimes correct, but if the GP knows the patient's current condition, then we can directly write it's an updation letter.
Okay.
Okay, because maybe a patient is going for the GP's consultation. It's maybe for a childhood vaccination, and after a long gap, the GP will attend the patient. It's not means that it's an updation letter. Okay, it's for that type of letter we can just write, I am writing regarding your patient, but not mention. It's mentioned that your patient is needed for your letter. Okay, I am writing in regard to your patient, Mr. X, or I am writing regarding your patient, Mr. X.
Okay.
Okay, so other than that, the updation letter. Okay, hope you understand that. Once again, I will told that it depends upon the current health status of the patient, and the GP is not to that patient and also the current health status. Then we can directly write, we can update the current health status of the patient. Then otherwise we cannot use update.
Okay.
Okay, clear? Okay, then moving to the next one. Is there any necessity to put comma after patient name in introduction paragraph? Okay, if you are not mentioning who, then we can't, it's not mandatory to mention as comma there. And one of your patient, the word one of your patient we are using in the introduction section, then we can use comma. Okay, but it's not mandatory.
But punctuations are there if we are starting with the patient name introduction.
Yes.
For Mr. X, comma, a 50-year hyphen old or retired teacher, then you have to close with a comma.
Yes.
Then you can continue with the who requires or something else. Okay.
Yes.
So,
and ma'am, I think many of them have doubts regarding the writing, isn't it, ma'am?
Yeah.
So because there will be a lot of questions in our YouTube. Okay, so then our next question is from Manya Krishna. Hi ma'am, is there any necessity to put comma? We are dealing with that. Okay, we are already dealing. And then Donna, please explain the situation which we can write maybe. Okay, because when the GPs knows the condition may not be knows. Okay, like the personal history of the patient in a non-case letter we can use maybe.
Okay, as you may know.
Yes, as you may know.
That is a correct format, I think. As you may know. Maybe GP had known about the patient, but sometimes we don't know whether he knows or not.
And for if a patient need sometimes may not be need a possible reference, like referral to a pediatrician or referral to a respiratory specialist. Maybe the patient need or may not be. At that time we can mention as may need or may not be need, or like possible, the word possible. Okay, then ma'am, the next question.
Almost everyone are asking for the tips how to organize a letter. So is there any more tips to give for them?
Actually, there is no any tips actually, but a lot of students have the problem with the organization, and I told to my students that there is the three key part for the OET writing, because for an organization we need to remember when we are writing a letter, we have to remember that there is the three things. That means first one is our reader. Who is your reader? Okay. Then second one is our current patient status. current condition of the patient, and what's the recommendation paragraph. That means the future care which is needed for the patient. Okay, these three things we have to remind in our mind when we are writing a letter.
Okay.
Okay, that depends upon the organization.
So these are the 3 tips
Yes.
which we can give for our students.
Yes.
Okay.
And when we are dealing with the organization, okay, a lot of students have trouble in maintaining organization. Keep in mind these 3 things we need to remember in our OET writing.
Okay.
Okay, and the next question is, Mr. X who requires care from your care in home visit, can we write? Yes, we can write that like that. In home visit letter, we can either write like that, like I'm writing to request a home visit for Mr. X who requires assistance and follow-up, anything else.
Okay.
Or either we can write, I'm writing to refer Mr. X who requires home care and management.
Okay.
Okay, then we can, but in that introduction, we have to mention this is an home visit letter.
Okay, ma'am, one more doubt is there. If in the letter they are given some home services, a coordination of some home services, by seeing that whether we can write, I'm writing to request home visit for so and so?
No, it's better to write, it's like an home care is needed for who requires home care, or who requires care in home, or who requires care at home. Okay, it depends upon our letter, but it's better to write if they are mentioned like it's an home visit. The word visit is there, we can write it's an home visit letter.
Okay, many of our students will see only home. After that, they will decide that it is a visit.
It's a home visit.
They are writing introduction like a home visit.
Yes, if our question like a hint, like given a hint like it's an home visit, then we can write. But definitely we can write, but in other cases it's an kindly provide care in home, we can't write. It's better to avoid it's an home visit.
Okay.
Okay. And then coming to our next comment, that is, ma'am, could you please explain about formulating the content? Okay, I already mentioned
like I think organization.
Organization, that's the content.
Okay, so we already given that tip, so please watch it.
Yes, actually, that's once again I explained that like it depends upon our reader, and it depends upon the current condition of the patient and the recommendation. The recommendation means the future care that needed for a patient.
Okay.
Okay. Okay. Then next one, writing regarding your patient, is it correct in case of regard letter? Can we write that? Yes, of course.
Yes, it's already we had dealt with
discussed.
This, discussed.
Okay. Then, ma'am, please could you give some suggestions for maintaining proper organization? That already I already told you that it depends upon the current condition. Okay, this the 3 things.
Yeah,
okay,
reader.
To repeat it again.
Okay, first one is reader. Second one is the current condition of the patient. Third one will be
the recommendation.
recommendations.
Okay. Then if the reader address is the nursing coordinator, means what can we write, dear nurse director in the salutation, or we have to write dear sir. Either we can write sir and madam, or we can directly write dear nursing director or dear director. Okay, it's better to write dear sir and madam.
That is the safest, I think, is the one of the safe thing.
Safest thing is that we can write sir and madam here.
Okay.
Okay, and moving for the next, is there any need of using capital letter for neurologist if a patient is having a visit by neurologist in body paragraph? No need to mention. We can simply write neurologist in a small letter. Okay, no need to mention as in capital letter. Okay, that's the safest way. Okay, we have to remind that the safest way is that we have to simply write in same format as like your letter they will provide. Okay. Then
so yeah, and one more thing which I need to tell, handwriting is one of the main things in the OET letter.
Okay, yes, if you are writing an adequate data and adequate information according to your letter, but if they no need to or they can't read it properly, then there is no any usage when you are writing that letter, is it?
If a reader is finding difficulty to read the information, then I think they can't score more, right?
More, yes, because it should be in a proper reading pattern.
Clear and...
Yes, clear. We need to maintain this in a clear pattern.
Okay.
Okay, then ma'am, next question.
So how many paragraphs can we write in a letter? One of our student is asking.
We can mention as maximum 3 to 4 paragraphs. Okay, but we can't use more than that, because one paragraph for maybe for the past history or plus social history, or maybe for the past, then another paragraph for the social history, and then another paragraph for the present. Okay, it depends upon the organization, we can maintain it, but we should maintain 180 to 200 words count in a letter. Okay.
So ma'am, balance we will deal with our order. So first we dealt with the introduction, then we started with the first body paragraph.
Yes.
So if it is in the urgent referral, we will deal with in the first body paragraph, we can see the current status of the patient.
Yes, and here is a slide regarding an question paper. Okay, and we will show a slide. It's in a question like it's an urgent letter. Okay, named Raquel Jackson. Okay. In that letter, the most of the students are doubtful regarding whether they need to mention the present history first, or the past history first, or the social history first. Okay. The letter is little bit confused, I think. But if they are providing a data like it's an urgent letter or immediate letter or an emergency letter, we should maintain the today's history first. Okay. And if the condition is that much important for our writing, then we have to mention the today's history first. Okay. That's letter, I think it's a letter for an emergency, to an emergency department. Sorry. And then we are dealing with the hypoglycemia patient. Hypoglycemia, it's due to a drug interaction. Okay, hypoglycemia due to drug interaction. We can mention the introduction like the patient has hypoglycemia due to interactions of either we can write the
interactions of drug or due to drug interaction.
Due to drug interaction, that's the main thing.
Or we can start with a thank you for seeing.
Yes, but it's better to write, I am writing to refer Mr. X who requires urgent assessment and management. Okay, then in that we have to maintain the today's history first. Hope you understand that, because it's an urgent letter. Okay, then we have to maintain the today's history first. Then coming to that, then we have to mention the past history. Okay,
so it is considered as an unknown case.
Yes, of course, it's an unknown case and it's an urgent letter. Okay. And then in coming to that letter, the letter name is Raquel Jackson. And in today's history, we have to mention that what is the today's vital signs. If they are providing the entire detail regarding the vital signs, then we have to mention that also, because this is a letter for an emergency department. Okay, we have to mention the vital signs, including the if there is a blood sugar level, we have to mention that also. Okay, then the next one is coming to the next past paragraph. Okay, after the today's history, we have to mention the past history. Okay, but I think that the patient is going through it home visit. Okay, this is a letter which is written by a community health nurse, and then the nurse introduced like this: the patient is going through a home visit. Then at the time of my home visit, the patient had this type of problem, and so like this. But during today's visit, that's our first body paragraph. During today's home visit, we have to start with that. And during today's home visit, the patient had this type of vital signs, and if the nurse provide any of the management to the patient, then need to maintain that. Then after that, we have to start from the past. Okay, the home visit is started from the past because the patient maintains some difficulty to manage his condition, and then balance. Okay,
so this is an example for the unknown case, and you can see the organizations
of an urgent letter.
Urgent letter. Okay. So I can give one more example.
Yes, you can.
Mr. James Hutton, where we can use in the introduction has undergone, because the patient came to the hospital in the morning and underwent the surgery. So afternoon we are transferring the patient to the another place for the overnight care. So you can mention in the introduction that I'm writing to transfer, or either you can start with the patient name. Then you can mention he has undergone a right corneal graft. Okay, so then the next paragraph, the first body paragraph, will deal with the present condition of the patient, but the first body paragraph will start with the first line will be denotes the past history, because already the patient got the same condition in the past, so it is related to the present. So we can start with that past history in the first sentence and the first body paragraph. Then we can go for the present status of the patient, how patient came to our hospital, to the hospital, and what are the things we did for the patient, and what is the current status of the patient. Then we can mention the second body paragraph about the social history. Then we can go for the recommendation. So this is one more example for the organization for the unknown case. Okay, so I think everyone got an idea right?
Regarding the emergency letter and a normal letter.
Okay, so
and then ma'am, there is a concern that ma'am, could you please explain about the word count? We are already mentioned that 180 to 200 word. Will they count the word into in intro para and discharge para also? Yes, of course. They will start from the intro sections and to the last. They will count the word. Of course, there is a criteria. It's not an criteria, but they will provide it's an urgent part in our OET writing, because 180 to 200 word count should maintain in our OET writing.
Okay, so ma'am, one more question is there. How many connectors can be used in our OET letter?
Okay, actually, it's not mandated to mention connectors. That means the complex connectors in our letter, but we can use maximum connector, 3 connectors, maximum 3 connectors in our letter, like therefore, however, or like that.
Okay, so how we can use these connectors, for example, for which and therefore? For example, he has had diabetes for the past 2 years. For which he takes metformin.
Yes.
Okay,
we can use for which like that.
Okay,
he
but
has
punctuation should be before the for
before
which.
the for which we need to mention a comma there. Okay. He has had hypertension since 2006, for which he takes metformin. Any other medication related to hypertension. Okay. So that's the usage of comma.
And ma'am, please tell them that whether for which is a one word or a 2 word.
It depends upon the letter, but commonly we are writing the for which is in a 2.
Okay.
Okay. Then another question is that can you please tell the use of recovering from or has been diagnosed and has been treated and has in purpose para. Okay. So commonly we are using recovering from for a surgery. Okay. Recovering from hip replacement surgery. Okay. We can commonly use the word recovering from or recuperating from.
Okay.
Is it, ma'am? Okay, we can write like that. And then another question is has been. Okay, has been diagnosed we can use when a diagnosis is diagnosed at the current condition and maybe it's continuous for continuous. That means for the future maybe that condition is extended, maybe for 2 days, maybe for 4 days, or for the lifetime we can use has been.
Okay, then when we can use recovering from? I think he is recovering from a total knee replacement
surgery.
Okay, so if we are using article, I think then there is no need to add surgery.
Yes, if you are mentioning A, no need to mention a surgery, and if you are using surgery, we no need to mention as A.
Okay, so this is the area or the case where we can use is recovering from.
Yes.
Okay.
Then another question from Revati Subhash. I am writing to update you about the current health status of Mr. X. I am writing to update, no need to mention as you. Okay, I am writing to update the current health status of Mr. X.
Okay.
You can simply write like that. Okay, then another, ma'am, handwriting have any role in writing? Okay, already we discussed regarding that. And another question is, ma'am, where the OET papers are corrected, India or Australia? Okay, actually, it's not our concern because they will mark the or check the OET papers maybe in Australia or maybe the officials from the abroad. We didn't know that we can't say that like that. They will validate that. That's enough. Okay, and we need to maintain our good writing in our letter.
Okay.
That's enough.
Okay, so as where we stopped the till body paragraph we reached, and then we can go for the social or past history.
Yes.
So we are discussing about the letter, right? So introduction of you already explained. Then after that, first body paragraph. Then how they can write the social and the past history.
Okay, not every letter need a social history. Okay, it depends upon the letter and the content and the current status of the patient. Okay, because the patient maybe have some difficulty in walking. Okay, that's the current condition. Maybe the peptic ulcer or any other food ulcer is the patient condition.
Family history also we have to mention if the patient is having the same condition.
Yes.
If he is having a family history, okay, so that also we
has
can
a history of family history we can write, but no need to mention a smoking history for the patient in that letter. If it is necessary for the recommendation or the future care or the current condition of the patient, then we can write. But instead of that, no need to mention every letter. I'd say here she smokes 10 to 20 cigarettes per day. No need to mention that. If it is necessary for your reader and the current condition of other food, as like our organization, it's like that we need to mention the family history or the past history or the social history for the patient. Okay.
So after that we can say write or we can start with the recommendations.
Yes.
Okay, so it would be appreciated.
Yes,
We can
but
start
ma'am,
with
it's not mandatory. We can start with it would be appreciated. We can either
upon the discharge.
Yes, upon the discharge, or we can directly write kindly provide appropriate care for the patient, or please note that he need to. But if you're writing like it would be appreciated, it's for a simplicity of the letter, or it's an humble request from our side. Okay, that's why we are mentioning like it would be appreciated. Okay, so it's not mandatory. We have to write the recommendation paragraph like this, but it's better to write.
Okay, so when we can write was diagnosed?
If the condition is diagnosed previously or already diagnosed for the before 2 to 3 days or yesterday or a day before yesterday, we can directly write was diagnosed.
Okay, it was asked and it was commented by one of our students. That's why I asked you.
Okay, sir.
We can use means it is already diagnosed in the past.
Yes.
Okay, so if the
Past means maybe yesterday, day before yesterday, or previously. Okay. Then it is important to expand the frequency of medicine, like if required rather than yes. Kindly avoid PRN. That means if required or if necessary from. So kindly avoid that PRN from our letter. So we have to expand like if necessary or if required or if needed.
So whether we can write which is given in the case note like main morning. Any like that we are saying we can continue in our letter or not?
No ma'am, actually we have to expand that also.
Okay, that also.
Okay. So we need to avoid maximum abbreviations from our letter. That's a good letter.
And please try to avoid the same sentence or words from the case note. That is also very important.
Yes, it's very important. And the next question is that could you please tell, okay, can you use the repeated words that we used in the first paragraph in the second? Okay, we have to avoid the repeated words, okay, but we can start with the patient name or he or she, that's the subject. Okay, we can use, but the subject is not a repetition. Because we are our main part is our subject, he or she, so we can start with the he or she in a paragraph. That's a good manner. And if we are repeating he or she, that's not a mind, but we have to avoid the repeated words.
Okay. Many of our students are having problem with the sentence construction and the grammar issues. For them, we can tell that we can join in our offline classes because we are having a batch for the grammar. So it is called as GMB. So if we are interested, you can come and join in our online or offline classes.
Yes, for our offline students, we are conducting an 1 week grammar sections. We are conducting separate classes for the students, regular students. I think GMB, basic grammar classes are providing after our orientation classes. So I think it's very much beneficial for the students who are not supposed to say like
construct a sentence or
yes, construct a sentence or in speaking. It's very helpful for us speaking also. So and there will be a grammar classes including exercises and the grammar books are there.
Yes.
And I think it's very much helpful for our students. Okay, most of the students are from Malayalam medium or like I'm also a government student. Okay, so like me, there are so many students are there, so it's very helpful for that students. Okay, and actually, this is very helpful for the regular batches. So come to attend with us. Okay, so try to conduct that. Okay, then, ma'am, next question.
So could you please tell me, explain the difference between was provided and was provided with?
Okay. Actually, we are not using with after provided because we are already provided something. That action is already we are doing. Okay, so kindly avoid with after provided. We can directly write he was provided education regarding something.
Okay.
Okay, or he was provided medicines.
Okay, he was provided compression stockings.
Yes, also we
Okay.
can. So kindly avoid with after the provided.
Okay.
Okay. Then,
Then the main thing has undergone and underwent difference.
yes.
Okay.
And commonly for a surgery, okay, example a surgery for a hip replacement surgery, if it is performed today, we can use has undergone. Okay, and if the surgery is happened or performed yesterday or day before yesterday or any time in the past, we can use underwent. That's the difference. Okay, that means underwent in the past and has undergone we can use in the present for a surgery case.
Okay.
Okay, because I'm especially telling that the surgery, the word surgery is we are commonly using our OET letter. That's why I am telling like the surgeries cases. Okay, okay. Then I'm next.
Okay, so one of our student had commented that, ma'am, in your address, if any numbers are coming, is it necessary to add 0 to that? For example, date 2nd February, if it is given, whether we should add 0 before that number?
No, it's not mandatory to add 0 before that number. We can just like 2 May 2021 or 02 May 2021. Either we can write in the board manner. But if you are starting with one format, you have to continue with the same format till the end of the letter.
Okay, so then could you please give one example when we can start or when we can write social background in the first as a first body paragraph?
For a
Social worker.
For a social worker, we have to use the social background first. And for another letter, it's only depends upon the letter. Okay, it's only depends upon the letter because if we are writing to a community health nurse, it's not mandatory to write a social history first. It depends upon the current health status of the patient and like our organization. We already discussed that it depends upon the current health status of the patient and the future care of the patient.
Okay.
Okay, so it's not mandatory that for a community health nurse we need to write a social history first. But for a social worker, we have to write the social history first and to avoid the maximum usage of medical terms in that letter.
Okay.
Okay.
And try to avoid some judgmental sentences also.
Try to avoid.
He's a heavy drinker.
Yes. If they are providing like a heavy drinker in our writing question paper, then we can. But we can't use as an assumption. Okay.
By seeing smoking habits, by seeing that we can't judge the patient like he's a heavy smoker and drinker.
Yes, we can just use he use or he smokes 20
cigarettes and drinks occasionally if it is given.
Yes.
Okay.
Okay. Then another doubt is that if the reader is a gastroenterologist and in salutation, dear gastroenterologist, is it correct? Okay, then gastroenterologist is a doctor. We hope you know that, but we have to use dear doctor. Okay.
If name is given, you can write.
Okay, if name is given, you can use the second name.
Second name.
Okay. Then next one.
So, ma'am, can we write is diagnosed within in intro paragraph? Is diagnosed.
Maximum we can use is diagnosed. We can directly write he has. He has that condition. He has schizophrenia. He has depression.
So I think it is safe to use he has.
Yes, it's safe to use he has. Okay. And another question is, ma'am, please mention the terms which should be avoided in OET writing. Okay, like hence. Hence, we can avoid the word hence in our letter because in our complex connectors or the symbol connectors are there, but we can use other formats, but have to avoid hence and even though from our letter.
Even though. Okay.
And then there are a lot of things we have to avoid from the letter, but the time is very limited, so we had only mentioned the hence and event. Okay. Then
I think we can see one more letter and we can see how the organization and which type of letter. So we can see one and we can just tell the examples to the viewers. Am I right?
Yes, but ma'am, we are already mentioned the an emergency letter and a normal non-case. Shall we discuss with some one non-case letter?
Okay, I'm ready.
Okay, so this is a simple letter but a little bit difficult or confused letter regarding students, and the name is Teresa Wimbledon. Okay, the Teresa Wimbledon means the letter is for a general practitioner, the patient's general practitioner, and that means the doctor name is Mondashe Dorothy, and the letter is for the general practitioner of the patient, all general practitioner for the patient. And we can start. How we can start? The condition is suspected or suggestive symptoms of depression. Sorry, depression is not dementia.
Okay, dementia. So we can start. I'm writing regarding your patient.
Yes, it's a suspected case or a suggestive case. That's why
It
we
is
have
not
to.
confirmed. Diagnosis is not confirmed.
That means the GP didn't know the condition of the patient, so we can directly write, I'm writing in regard to, or I'm writing regarding
your patient.
Yes, and
Okay, so-
and the condition is that shall I read it?
Okay.
Okay, I'm writing regarding your patient, Mrs. Teresa Wimbledon, who is
Has
okay, yes, who has suggestive symptoms of dementia, and she requires further investigation and treatment to improve her condition.
Okay. So
that's the introduction.
will be- okay.
Yes, and hope you understand that what's the difference between the when we can write the updation and when we can write the I'm writing in regard to. Okay, then in this we have to mention when the patient's home visit. It's an home visit. The patient is in home visit, and we can start from where the home visit is started. And the nurse has started a home visit for the patient, and the nurse is conducting the home visit daily manner. And
So
we have
it is a known case, so we can start with as you may know.
Yes.
Okay.
As you may know.
Comma.
Okay, either we can mention as you may know. And coming to the next paragraph, we can mention that today's history. Okay, on today's visit, her neighbors reported that.
Okay.
And so,
Today's is or during a home visit.
yes, during a home visit. Okay, and in the first body paragraph, we can start with, as you may know, Mrs. Wimbledon has been receiving a home visit to manage her infected knee injury, because the patient had an injury from the past. For that knee injury, the patient need the home visit.
Okay.
Okay, that's why we are starting from there. Okay, because it's not an urgent letter, and we have to write this for a GP. Okay, as you may know, we can use. Okay, it's safe to use as you may know.
Okay.
Okay, so hope you understand this letter. And ma'am, shall we go to dealing with the next?